in Boston, where some of the nation's leading pediatricians share valuable insights into those first feedings with your newborn.
The first few days of nursing and feeding your infant are scary. There's no other word for it. And it's not indicative of how feeding is going to be throughout the infant's first year.
It's always an art form between the youngster and the mother. Sometimes the mother is willing and ready and the youngster is just sluggish. Sometimes the youngster is a young barracuda and the mother is taken off guard.
It is a learning process. It's a physical skill. Now, it's one that we've been doing for thousands of years, and the chances it's going to turn out great are very, very high. But it does take a little bit of patience.
Some babies come out and it's absolutely normal and natural for them to be able to do it right away, and other babies, it just takes them a while to figure out how to do those motions with their mouth effectively to be able to eat. But sticking with it, they all will eventually get it.
You want to make sure you have everything organized in front of you. Have the phone near you. Often when you start to breastfeed, you get very thirsty. So you want to have a glass of water in arm's reach and anything that you might need so that once the baby has latched on, you don't have to disturb him. You can sit and nurse quietly.
For bottle feeding, wash your hands beforehand, clean the bottles afterwards. So just having an area of your kitchen set up to be able to do that. But really, it's just having a quiet place to feed so that they can concentrate and you can enjoy the bonding with your child.
Remember, babies only need to do 4 things: eat, sleep, poop, and pee. And eating is a very important component there. So I tell patients that babies will double their birth weight somewhere in the vicinity of 4 to 6 months. That's what we're shooting for. So that gives them a target, but it doesn't tell them that they have to weigh the baby day to day or week to week.
What comes out is a great way to know how much is going in. If you're not eating, you're not going to pee or poop as much. You'd really like to see some sort of output with every feeding. So that's often 8, 10, even 12 urines or even stools a day. It's not unusual for a newborn to poop every single time they eat. Lots of dirty diapers is a good sign.
Feeding a baby is just such a wonderful experience, both for the mother and father. It's wonderful for a mother to be able to take one of those feeds off and have some downtime for herself, enjoying the time that you have with the baby, but also realizing that other people can be involved and bond with that baby as well over feeding is really wonderful.
When babies are born, they're born into a very foreign environment, and all they know is what they feel. And what they feel is the ability to bond with their parent. Sight, sound, smell, taste, and touch. The idea of bonding initially provides security for them. And the whole purpose of the first year, psychologically and emotionally, is security and trust. And that starts with bonding right at minute 1. The sound of your heartbeat, the feeling of your skin, we know that these babies tend to regulate their emotional state better, their blood pressure, their pulse, their breathing. That helps with all those things, and then it also has long-term repercussions for how the baby and the parents feel about each other.
The bonding that you have with your baby during feeding time, whether breastfeeding or bottle feeding, is invaluable. Holding the baby up close, the skin-to-skin contact, it really is very important for your baby's thermoregulation. Your heartbeat actually helps to soothe the baby's heartbeat, and you actually will get into a rhythm with your baby. It's a wonderful, wonderful opportunity to create a bond that lasts a lifetime.